Hello yogis, friends, internet buddies. This short tutorial is about our backs. I've been teaching yoga for about 15 years now, and the common complaint that I get from students coming in is the doctors told them to try yoga because they've got a bad back. There can be different types of bad backs. Let me just quickly tell you. There can be sciatica, which is a trapped nerve. The sciatic nerve gets trapped. There can just be compression tension, where the discs are being squashed and the bones are sort of coming together in the vertebral build up. The building blocks get like compressed. There can be stress and anxiety and maybe depression can cause muscle tension, and muscle tension is causing the spine to compress as well. So most back problems are due to compression, and it doesn't really matter what the problem is. The solution is generally the same, which is to decompress the spine and stretch the back muscles. So you've got two major muscles running down the side of the spine called the erector spinae, and they are linked to your emotional stress as well. So when you get stressy, you get anxious, the muscles contract, and it starts in the back of the neck as well. So the symptoms can be headaches, poor vision, insomnia, maybe even tinnitus, and definitely back pain, and maybe even all the way down to sciatica. So join me on the floor for these 8 simple exercises, and hopefully you can keep this video. If you get a bad back, just return to it or write it down, and maybe just do it every day as like maintenance. So here we go. The first one is to get yourself a back block. So just give me a second. So here's a back block, and it's really light, and you can get them from any sports shop, and they used to be really expensive, around £25 years ago. You can get them as cheap as £1.99 now, so they're worth investing in. Okay, if you haven't got one, then a couple of cushions will do, or a book or 2 thick books together. But it's not as good as this. This is sticky and it doesn't fall apart. So get one of these if you can. And the first exercise is called the back block. So you place the block underneath your sacrum here like that, and then you just take your legs down and you relax simply on the block for around 1 to 2 minutes maybe. Excuse me. If you have got serious back pain, this is probably going to feel really uncomfortable. So please don't let that faze you. Just bear with it, because what it's doing is putting the bony segments back into where they should be. Alright, so just trust this one. You can, after 30 seconds, you can raise it up a little bit higher and let the feet just fall back down, and just all you're doing is hanging around, just letting the block do all the work for you. The other thing I was going to say is, if you're not sure what your sacrum is, generally it's kind of where your bum crack is. So the block is on the bum crack area where it comes to an end. So it's never on the spine, it's never on the discs, it's on a kind of diamond-shaped flat bone known as the sacrum, which is just before the tailbone right at the base and just before the vertebral bones above it. Okay, so after 1 or 2 minutes, or maybe even longer, just bring your knees up like this, lift your pelvis, take the block out of the way, and then tuck the tailbone under, and then just carefully bring yourself back down. Okay, that might feel a bit uncomfortable, but that's normal. The second exercise is called the knee bouncer. So literally just pulling the knee and letting it go. And you do this about 8 to 9 times. And then you just let that leg gently go. And then other leg. So it's kind of releasing stickiness around the hip, the lower back area. And then 8 or 9 times on that side. Now this third exercise is, I'm not going to lie to you, it's a bit more challenging. So if you've got a friend or a family member that can stand on your feet, ask them to stand on your feet right now. You're going to lift yourself up and you're going to curl all the way up and then curl all the way back down again. About 8 to 15 times. And as the muscles strengthen, you'll find that you won't need anyone to stand on your feet. If you haven't got anyone, then maybe just take your feet under the sofa or just curl up halfway, just curl up a little bit, maybe heave-ho and really force, yourself to strengthen up. But it's not like, what we're doing is we're curling up and curling down. So we're not forcing, we're not, being brutal with ourselves. Should be a fairly smooth action like this. So how many times? Around 15. I've lost count, so let's just do a few more. I tend to talk a lot. Got so much I want to say to you. And it just seems to come out all at once sometimes. So keep up with it. That's it. Okay. The next one is called the self-traction twist. Bit of a fancy name. So you're going to lie on your back again and have your feet wide apart. Okay, and you're going to let your knees drop down to one side with your body down on the floor. Take a big breath in and then slowly take the legs back up and over to the other side. So what happens is this side of the hip lifts, this glute lifts, and it's kind of causing the sacroiliac area, the lower back, to release. Probably do about 6 times either side. So the knee that's on the inside wants to really go down, down, down. So you've got that lift going on in the pelvis area. So try and really push it down, let the hip rise up. And then just keep swapping sides. Okay, and then come back to neutral. Always push the lower back into the ground. This next one is a really strange one. It's just called the pelvic slant. And you're staying on your floor and you're just going to push one knee forward like that. So just push it forward. Notice the hip rises. Come back down, push the other knee forward, back down, swap sides, back down, swap sides, back down, swap sides, back down, a few more. So really want to try and get that lift in the glute and then lift and forward in the other glute and just do a few more. So I'd probably aim for around 8 each side. And if they're done on a regular basis, then you've got nothing to worry about. You don't need to do too many. And then just relax. Now the next one is called the Sciatic Stretch. So you could do with a yoga belt or some kind of... So I've got on this chair here a t-shirt, a long t-shirt. Alright, so let's just see if that works. So you could use a towel. So you wrap the towel around the leg, hold it with one hand, opposite hand, and start to guide it to the opposite side of your body. So taking my right leg over to the left side, lifting the right pelvis and stretching. Now I can go all the way down, but don't force this, okay, because it can be quite strong in your back. So just relax here, breathe. And you'll find the more you relax, the more the muscle tissue starts to give. But if you've got serious lower back pain, then just go a little, just go to here, don't go too far. Wait till your back starts to heal. So let's do the other side. You've got your towel or tea towel around the leg, or t-shirt, and then you're going to take it across, slowly does it, and just try and keep the other leg pointing upright, so kind of an internal rotation. So again, it doesn't have to go all the way down, just do what feels therapeutic for your own body at this point. Take some big breaths and then come back up again. Release, get rid of your towel. So that's 7, we've got one more to do. So I'm just going to show you, you're going to just take your feet hip distance next to your hips. You're going to curl your tailbone and you're going to lift your hips and lift and lift and lift, and then you're going to walk your shoulder blades in together underneath and hold your bridge. Feet parallel to each other. You're really trying to get some height now. You can play around with squeezing the glutes gently and then relaxing them. Squeezing the thighs gently towards each other. Or if you have got a block, you can place that between your knees to keep the hips in the right place. Okay, so just squeezing the knees in will make you activate your glutes gently, and it will keep your lower back in the right position. So what we're trying to avoid is the legs splaying out. So we just parallel legs. Let me show you from this angle. There you go. So just parallel legs, squeeze, and then release and come back down. Then just reward yourself with legs in the air, arms in the air, arms over the top, little lift of your upper back, and then release down. And then just kind of move your hips from side to side, your knees, and just notice how that all feels. You do those exercises morning and evening. I got those exercises from a book called How to Heal Your Back, and the author's called Sarah Keys, and I believe she used to be the physiotherapist to the royal family at some point, but it's a very old book, and it might be worth, if you're a yoga teacher or if you're interested in keeping your joints in good shape. She goes through every single joint, and she talks very much in layman's terms, so it's very easy to understand. So I hope you enjoyed that. Let me know how your back is. Stay healthy, stay happy, and have a great day. Namaste.